When you run your blood pressure, you get two numbers. The top number, which is called the systolic, is how high your blood pressure goes when your heart pumps and squeezes. It's getting you a good sense of that kind of that max that you're getting there from blood pressure. Then the bottom number is sort of like your resting blood pressure. That's as low as it goes. And we care a lot about that because if you think of the blood pressure cycle, the heart pumping cycle, 1/3 of the time is spent during that pump, and then 2/3 of it is more in that relaxation phase. So most of the time, it's actually in that relaxation phase, hence why we care so much about that diastolic number, that bottom number there. A couple caveats to remember: your blood pressure does naturally go up when you are exercising. That's normal. So if you ever check your blood pressure right after you work out, it's going to be falsely high. That's one of the things that we want to make sure that you avoid, is checking it right after you work out. And then in general, related to that, we try to measure it when you're at rest because that's where it is the majority of the time. So new guidelines that came out in 2025. And I think this is important because I've had a couple friends and a couple patients who have actually been following the old guidelines. What's really different about the new guidelines is this bottom number, that second number, diastolic. That should not be over 80 at any point in time, in which case you're considered to have stage 1 hypertension. The upper number, we want that below 120, but we have a little more wiggle room between 120 and 130. Okay, that's the goal. If you are elevated, though, you definitely want to start intervening. And a lot of what I'm going to talk about today is the interventions that you can do that do not require medications, which really are preferred because there is such a thing as too low of a blood pressure. Now, there's not an actual cutoff, but this is based on symptoms. And the symptoms that you'll often see is that you're not getting enough blood to your brain. So you'll start getting dizzy or lightheaded. Some of you may have experienced when you go from laying down to sitting and standing up, you might get lightheaded. It's kind of a similar concept there, except it's happening all the time. So that is definitely something you want to look out for. And that's why we really want to make sure that you do have an accurate blood pressure reading. There's a lot of things that can alter your blood pressure and give you a falsely high or a falsely low reading. And we don't want that. But one of those things is not being rested for 3 to 5 minutes, having a full bladder, being in pain, being stressed or annoyed. All these things can give you a higher blood pressure reading than you want. And let's be real. A lot of times you're at the doctor, they're running late. Maybe you're a little frustrated. Maybe you're running late. You're just running in and they're checking your blood pressure. This is not a super accurate way to do it. And more importantly, you really want to check it a few times every time you sit down. You might run it and get a 120 over 80, and then you run it again, and then you get a 140 over 85. Well, which one is it? What's the right one there? So what I tell people is run it 3 times. And if you got a cluster around one of those numbers, that's roughly what it's going to be. And then you want to check it a few times over, say, a week, 2 or 3 times over a week, so that you really get an accurate reading. None of this is, of course, feasible at the doctor, but there are automated blood pressure cuffs. This is the one that I like, that I send for my patients. It's about $40. Comes with batteries. You can replace them when they run out. You just sit down and you run the cuff. Boom, you're done. I find that to be the best way to make sure you are getting a good and accurate reading. If your blood pressure is normal, you could run it once every 3 months. You just don't want to go years without knowing that it's too high. And if it's abnormal and if you are actually intervening on it, then once a month, once every 2 weeks, kind of depends on what you're doing, but you want to keep a closer eye on it if that is the case. Now, something really important to keep in mind is there are emergencies that can come up with blood pressure. So if your blood pressure is higher than 180 over 120, then recheck it right then and there. If it's still high, call your doctor or go to an urgent care center. That is, do not pass go. You need to do something about it. You can't just sit on it. It's potentially a medical emergency. So if you get one of those readings, make sure you recheck it, make sure you're doing it properly. And if it is real, then go get some help. One of the things that can cause it to be too high, however, is getting a blood pressure cuff that is the wrong size. If your blood pressure cuff is too small, that can increase your reading falsely by 10 to 40 millimeters of mercury, which is just the way that we measure pressure. Okay, so make sure that that cuff fits nice and snugly. You don't want to be like really, really tight. You don't want it to be like hanging off loose. Some people have to get a larger cuff. Some people have to get a smaller cuff. That's okay. Now, The fun part, how do you lower it? There are a lot of ways that you can lower your blood pressure with just lifestyle alone. Weight loss. For every 1 kilogram, which is about 2.2 pounds that you lose, that top number goes down by one and that bottom number goes down by one. That's a lot. That means if you lose 20 pounds, you can drop your blood pressure by 10 points on each of them. Lowering sodium, 1,000 milligram or 1 gram reduction of sodium can decrease that top number by 3 points. Now, you probably can only do this a couple of times. If you've ever tried to be on 1,000 milligram sodium diet, you're not eating very much that has taste. So probably you're not going to get crazy low on this, but this is a lever you can pull. An additional 30 minutes per week of aerobic exercise. And I would say for this zone 2 exercise, meaning you can still kind of talk, it's not like you're sprinting, it can drop you 2 points on that top number, systolic, and 1 point on the diastolic. This is an interesting one. Increasing your potassium can drop it by quite a bit, actually. 6 points on the top number, 4 points on the bottom number, and 30 millimoles per day of potassium. What does that mean? That's approximately 3 bananas, 2 avocados, or 1 baked potato with the skin. And then alcohol reduction. So if you drink more than 6 drinks a day and you drop it to 3 drinks a day, that can drop you 5.5 points on the top number or about 4 points on the bottom number. If you like to drink, you don't want to stop that, well, then maybe you can pull the lever on losing weight. If you're already at a great weight, maybe you can pull the lever on eating some more potassium. You can play around with these, and hopefully, if your blood pressure is high, you get to a point where you do not require medication to reduce it. And even if you do require meds, you can do some of these changes and then no longer need the meds or lower the dose. All things that should really be explored, because this is the best way to get that blood pressure lowered and keep your cardiovascular health safe.